Hey, it's a nursing professor. I want to talk today about resiliencies. I know we spent a lot of time talking about incivility, and it is my mission to keep that at the forefront. I believe it is a topic that is being discussed in various nursing forums. However, I have not seen it talked about when it comes to nursing students. And so it is my mission to keep that conversation going within the rooms where people can make decisions. I do think we will have significantly better outcomes if the incivil behavior stops, especially as it relates to nursing students who are there for learning, for nurturing, for mentoring, and all those things that faculty can contribute to make the situation, the learning situation, more desirable, more palatable. So today I want to talk to you about resiliency. And resiliency means overcoming those things that knock you down. You know, it forces you to get back up. And it sounded to me from many of the postings that happened when we talked about incivility that many of you all have found alternate ways to get back up. And so with that, that's good. It's probably a loss for nursing, but it's good that you didn't stay there, because sometimes incivil behavior can make you feel like you're this small, that it's hard to climb out of it. So I want you to definitely continue to grow that muscle of resiliency, because it doesn't only happen in nursing. It happens in any walk of life that you were talking about, especially when it comes to relationships where someone is in authority. And that could be your personal relationship. It could be, at any place of employment. So we need to put a stop to that, or learn better ways of dealing with it. And so some of the skills that I will ask you to think about when you encounter those types of toxic behaviors is dig into your true grit. Like, become determined to what it is that you want the outcome to be. So if you're a nursing student and you're determined you want to be a nurse, and something happens in the semester, be it a disagreement with a professor, that you didn't do something right, your grades are poor, whatever the case is, be determined about it and be accountable and responsible and an adult about it, to have a conversation, and have that conversation early. Don't wait until it's do or die and then you don't have a whole lot of support that you can stand on. Remain focused. Get your emotions in check. And this is hard. This is really, really hard for me, because emotionally, I would rather cry when somebody makes me feel bad. But no, don't give them the pleasure of seeing you cry, but give them more of, I'm determined to get this. These are the facts. My grades look like this. I did do this. What can I do differently? How can I study? Appease to the person. Put the ball back into their court so that they can come back to you and provide you with some of the things that you might need. You want to continue to thrive. And by that, I mean, find a solution to whatever the problem is. And so that thriving could mean that you can solve the problem with your professor, or with your program director, or with your dean, or whoever up the chain of command. Distance yourself from toxic behaviors, because sometimes, this is what I know for sure, sometimes people like an audience. And so sometimes when things go wrong, then people perform in a manner in front of an audience, meaning fellow students, that isn't the right thing to do, because that type of memory etched into a faculty member's mind can create problems for you. So detach yourself from the emotion. Don't try to put yourself in a toxic situation. Don't look for an audience. You go one-on-one with the faculty member. Keep a positive outlook, because life is unpredictable. Life can throw you some curveballs that you never saw coming. Learn from your past experience. If your previous experience wasn't good, dust yourself off, start all over again. And broaden your view. You know, sometimes people are kind of tunnel vision, like I'm right, I'm right, I'm right. No one is perfect. No one is perfect. No one is right 100% of the time. So I wanted to share with you this quick story that I had when I was a nursing student 100 years ago. I was in my pediatric rotation. I was a new mom. My son was probably like 8 months old or something. So I already had some barriers to success there because it was a little challenging raising a young baby. My marriage was in trouble. We didn't have any money. Probably as I look back, it probably wasn't the right time for me to go to nursing school. But I wanted to go. I was committed and I knew I was going to make it happen. And I did. Thank you, Lord. So anyway, I was having this pediatric rotation, and I was in a patient's room. It was about an 18-month-old baby who was really, really sick. And that was already hard for me because, as I said, my baby was probably about 8 months old. So the parents were there, and my learning task was to insert an IV. So I had the IV tubing, the IV bag, and I was to prime the IV tube. So I had my bag, connected my IV tube, and so as I was priming the fluid through the IV line, making sure that there were no bubbles there, then the tubing dropped on the floor. The tip of the tubing dropped on the floor. It was capped, but it dropped on the floor. So my instructor said to me, I know you're not going to put that into the child. She said it just like that. And I was like in my head, like, no, I really don't know. I know infection control, but I don't think we ever practiced this before. Long story short, I had never seen it before. It had never come up in discussion. This was kind of like how sometimes learning can be so fragmented, because I knew infection control. I knew that if something dropped on the floor and that going directly into someone's vein could be problematic. But I had never had this experience before, so I could not put two and two together. So long story short, went and got a new IV tube. I reprimed the bag, and I was nervous at this point, so it seemed like it took forever for me to do that. And by the time it got time for me to connect it to the patient, the instructor took over. So family was okay with it. We left out the room. We were in the hallway, and she berated me as though I had done the worst thing ever. And I wanted to cry, but didn't cry. And I let her speak. I was very silent about it, but also within me, I was an adult, a good adult. I had a child, and I had a marriage that was in trouble. So I was really in the back of my head, like, who did lady talking about? So I let her talk, and then I was quiet. And so she said, "Do you have anything to say?" And I said, "Well, no, I really don't have anything to say right now, but what I will do is I will make an appointment with you, and then I think we should talk about it." And I don't even know where that came from, but it was enough to cut that situation right there, because it didn't give her any ammunition to go on and on and on about this almost error that I would have made. And so then post-conference, of course, was very awkward because people had to talk about their day. And so, I said I had a child, and I inserted an IV, and I said I made a mistake. So I acknowledged it, and I kind of lessened the tone of it. And so I can remember that as though it was yesterday, and that actually was about 35 years ago. So I hear you, I understand. I want to keep the conversation going, but I want us to work on resiliency and building that muscle so that we can handle some of those adversities that come our way. Because life is not always good, it's not always smooth. There are things that you don't know. There's reasons that things happen that we have no idea, and sometimes the delay is there for us to take a moment to step back and come back in. So I leave you with that. We will continue the conversation. I'd like to hear what your thoughts are about that. And it is almost Thanksgiving. So I thank you all. I thank you all for your support and for your having these conversations with me. Happy holidays.